Hello, I'm Virender Sekhon, a pediatric urologist practicing in Gurgaon, Delhi NCR for over a decade now. The field of pediatric urology involves the prevention, diagnosis, and treatment of a wide variety of conditions involving the urinary tract as well as the reproductive system of both male and female children. These conditions might present from before birth, that is during pregnancy, to when they are born, that is infancy, childhood, or even up till teenage. Some of these conditions are diagnosed even before birth on pregnancy ultrasounds, or they may present later in life, right up till the teenage years. But the encouraging part is that most of these conditions can be treated early in life so that these kids do not have to carry the stigma of any of these conditions in their adult lives. Generally, a physician is either a medical personnel or a surgeon, but I believe that a pediatric urologist is an amalgamation of both medicine and surgery. The various conditions treated by pediatric urologists may start from a very basic thing such as a urinary tract infection, which may again have varied causes and may present either as fever or just a difficulty in passing urine. And in the benign cases, it may just be because of a thing as simple as constipation, or you could have like a bowel bladder dysfunction, or in the more severe cases, there could be anatomical malformation leading to vesico-ureteric reflux, wherein the urine goes back from the urinary bladder into the kidneys and causes urine infection. Another commonly seen condition by pediatric urologists is kidney swelling or hydronephrosis, which again may be picked up on pregnancy ultrasounds. Most of these again tend to resolve as the child grows older spontaneously, and a few of them may end up needing surgical correction later in life. As a pediatric urologist, I'm very passionate about treating urinary incontinence or urinary leaks in children. Now, the leak may present only during daytime or only during nighttime, what we call bedwetting, or it may be a combination of both of them. Again, there could be various reasons for this urinary incontinence, right from behavioral, psychological, or the more severe ones in which the nerves that control the storage and voiding functions of the bladder are not working well, a condition that we call neurogenic bladder. Or in other cases, there could be something called posterior urethral valve, which needs aggressive management during childhood and a lifelong follow-up, because nearly a third of these patients might end up needing kidney transplantation later on in life. And stabilizing the bladder before we can receive the new kidney is a very important part of what a pediatric urologist does. The other end of our spectrum of abnormalities that we see is called phimosis, wherein the foreskin is adhered and it does not allow the urine to come out normally, causing trouble to the child. A similar analogy in females is called labial adhesions. In males, it may be that the testis is not present in the scrotum on birth, and it is called undescended testis. So we locate the testis wherever it is present higher up and bring it down surgically into the normal position in the scrotum. The other spectrum of abnormalities that we see involves stones in the kidney or the urinary bladder. North India is a stone belt, but not all of these kids need surgical intervention. Initially, they may be managed by medicines, will need a metabolic evaluation, and later on pressing symptoms, they may need a surgical correction through minimally invasive techniques as well. Now, cancer in kids is rare, but you may still have cancers arising from the kidney or the urinary bladder, and this is a surgical expertise that a pediatric urologist handles. Another thing that I'm very dedicated and passionate about is treating kids who have something called hypospadias, wherein the hole from where the urine comes out is not located at the tip of the penis, but somewhere underneath the surface of the penis. This may even have a similar parallel in females as well. This needs a complex set of reconstruction in these kids. And although we try and do it in a single stage, but some of them may need multiple sittings for the same. The most complex end of the spectrum that a pediatric urologist treats is called the extrophy epispadias complex, wherein The child may need multiple sittings of complex reconstructions, but I'm very passionate about treating this condition. So if any time you or any of your loved ones is suffering from any of these conditions, please do look around and find a pediatric urologist that can help you treat these diseases. Thank you.